When it comes to an outbreak of an infectious disease, we are not fully prepared.
As a continent in general, we are not yet ready for the next pandemic.
Yes, we are doing something and we have made some improvement, but there's still a long way to go. That's why we are also advocating for the One Health approach. As a region, we are trying to improve coordination. But this is not a one-off event. You have to build it over time. It has to be within the system.
Since 2015, nearly every country of East Africa has been reporting cholera. Beyond that, we now have Rift Valley reported in South Sudan, Rwanda, Uganda, Kenya and Tanzania. We've had dengue, chikungunya, malaria of course is always there. We have still HIV and many more that are coming. So the region is besieged by infectious diseases.
As we discuss outbreaks in this meeting, let us always remember that it's anchored under priority 2, which is on rapid response, among the health sector investment priorities that we are driving for the coming 10 years. So as we discuss, our interest as the health department from the EAC Secretariat and all the partner states is to ensure that this priority is implemented. We need to mobilize all the partners, we need to mobilize resources to ensure that actually this priority is implemented and move forward on this one.
Rift Valley fever virus primarily circulates between ruminants and mosquitoes. Human infections result mainly from direct contact with blood or other body fluids from infected animals, or to a lesser extent, from bites by infected mosquitoes. The Rift Valley fever virus has historically been responsible for widespread and devastating outbreaks throughout the African continent, and has also extended into the Arabian Peninsula and Madagascar. Rift Valley fever outbreaks are true emergencies, as they affect large geographic areas, and their clinical presentations are impressive, both in humans and in animals.
Currently in Uganda we have outbreak of Rift Valley hemorrhagic fever in southwestern Uganda, and we are battling it.
We have Rift Valley fever ongoing in South Sudan. It was declared in January 2018, and up to now it is still ongoing.
We faced an outbreak of Rift Valley fever from May this year. It started the border with Tanzania, and the first alert came on 18 May.
We are quite well prepared, but that does not mean we are as well prepared as we can. There are still many gaps to be closed, and many of the participants here also I talked to said, well, I thought we were quite well prepared, but when I really look into it and when I follow this tabletop exercise now, I notice there is still a big gap, and there is still a big gap.
We are prepared in that okay, when you see an animal aborting, then we cannot assist them. That is by use of naked hands, in removing the fetus. No, nowadays we are prepared in that we have to put on gloves, so that you can be able to assist. That's can be a cow, can be a goat. Then, and again, after we remove the filters, we have to, to put, to dig a hole, put it, then you cover. And like there before, when we were not prepared, because I remember we was just handling the filters by naked hands, yeah?
In my view, as an East African, is for us to be able to have a coordinated region that can be able to predict a possible disease occurrence, be able, within the shortest time possible, detect, then respond in time with minimum casualties. That means we can be able to predict and eliminate the disease at source as we continue developing in science, and of course, improve the welfare of our people.